Happy Friday. Thank you all for being here to launch JFRD's new Critical Care Paramedic Rescue Unit. It is the third unit of its kind, and the good news is we've also got more to come. I'd like to thank JFRD Chief Keith Powers and JFRD's Medical Director, Dr. Brad Elias, for their leadership and foresight to create this critical care unit that delivers more advanced rescue care to our city. I also want to express my gratitude to all of our brave firefighters who put their lives on the line every single day to keep our community safe. This new team is comprised of critical care paramedics who have a higher level of training than standard care paramedics. While the unit will function as a standard rescue unit, it will also be dispatched to incidents that have more critical and urgent needs. The critical care paramedic unit has more advanced medical equipment and medications on hand as well, and they are able to administer blood, which, as you know, can buy valuable time for patients. JFRD is one of only a handful of fire departments in the entire country that has this capability. So in yet another measure, we are one of the top departments in the entire country. We are all proud of the fact they continue to be one of the best. About a year ago, JFRD created the first of 2 critical care units. Since then, they've already used their advanced training and equipment to save the lives of numerous patients. There's no doubt that many more precious lives will be saved with the addition of this additional unit. Public safety and health are top priorities for our administration, and the work of the critical care paramedic unit combines both priorities into one. Our budget has 10 more fire stations in the works, which will help reduce response times around the city, critically important with a city of our size. And we have a lot happening on the health side of the coin as well. Strong support for UF Health, our new Get Covered Jacks campaign to encourage the uninsured to get insurance, $1.5 million invested into Jacks Care Connect, and nearly $6 million in new programs for maternal and infant health. Also mental health, telehealth, and more that are coming soon when we get this budget through, this $25 million through, hopefully in the next several days. Our mission is a city where all of our citizens are healthy and safe. That is priority number 1. And today's announcement is yet another step toward that goal. With that, I'm going to turn it over to Chief Powers and Dr. Elias to tell you more about this exciting new critical care unit. And gentlemen, take it away.
Well, thank you, Mayor. I appreciate it. The kind words talking about our men and women who do put their lives on the line every day. They are what make us the greatest fire and rescue department in the country, and I couldn't be prouder of what they do. So thank you for those kind words. You know, the mayor made it very clear on day one that her priority was taking care of people, their health needs, and public safety. And this unit accomplishes 2 of those tasks. It's increasing the health care in this community, and it's also increasing public safety. You know, the advanced treatment that occurs on these units has already, over 30 times since we put the first 2 units in service, have administered blood and saved people's lives. And that's an amazing statistic, and speaks to the hard work and level of training that's required to get to this that our men and women do every day. You know, this area that we're in, Fire District 19, Fire District 65, 28, 20, and 30 are the busiest in the city. And this unit will be able to respond into those areas when we have somebody trapped in a vehicle wreck or somebody that sustains a gunshot wound or that needs blood, and it'll be able to respond into those areas and help those units and help those people with that advanced level of care. So, Mayor, again, thank you for your commitment to JFRD. Thank you for your commitment in the budget to make this happen. And with that, I'll bring up Dr. Elias.
So this is an exciting day, adding the 3rd critical care unit. Over the past year, we've had 2 critical care units in operation at Rescue 64 and Rescue 75. And over the past year, we've seen that this, which started as a pilot project, has been working. We carry a variety of medications that are different from our field units, whether they're cardiac, airway medications, or for blood pressure. When we utilize these medications along with some other procedures, the patients are arriving to the hospital in better shape. So I think that's has always been our goal, is to provide patients, whether they're suffering from a medical illness or a severe trauma illness such as a gunshot or a motor vehicle crash, we're giving them the opportunity to get to the hospital alive, and hopefully the hospitals can continue that great care. We have excellent partnerships with all our community hospitals. They've appreciated what these units have done, and we have great feedback when the critical care patients are brought to their hospitals under these 2 units and now the 3rd unit. So we're very excited for that. Again, real brief, what these critical care trucks carry, a medication called diltiazem, which would slow a rapid heart rate. Nitroglycerin in an intravenous form, which is used in heart attacks and heart failure. We also have a very potent drug called norepinephrine, which is a blood pressure medication for people that are suffering from shock state. So in addition to IV fluids and fluid resuscitation, this medication would raise the blood pressure. Then we also have a couple of paralytics to perform an airway maneuver called intubation, which again is in the appropriate hands can be very life-saving. So the critical care paramedics undergo additional training. We've purchased additional equipment to provide great care, whether it's intubation and a CMAC laryngoscope, whether it's a portable ventilator. We also carry blood products. We carry O-positive blood and liquid A plasma, which is given to our trauma alert patients with suspicion of hemorrhage. I think we provide a variety of additional medications, a variety of different medications, and clinically we are seeing the benefit when those medications and procedures are performed. That's all I'd have. I think we'd like to give a tour of the unit as well. Captain Mack is the program manager of the critical care unit. Okay, so right now we have a dispatch criteria, and obviously based on the 3 locations of the current stations, if something of high nature, high acuity is in one of those districts, or at least a neighboring district, these critical care units will be dispatched. Whether it's a gunshot, a motor vehicle accident with entrapment, the person's trapped and taking time to get them out, that's when these units would be dispatched.
So the way that we're doing that, if you notice, there's one on the west side, there's one on the northwest side now. Now we have one over here, and the intent is to go into the far southern edge of the county next, get in the 4 quadrants, and then expand out from there. So that way we've got this care in all areas of the community.
First of all, why can't regular ambulances carry those medications?
So you have to be on this team and be part of this. Our paramedics have to be board certified as critical care paramedic units. That's an extremely high level of training that's required, and the test is extremely difficult. So we're working through the department to get all of our paramedics trained at that level, but that process takes time to happen. So as we get enough paramedics trained, we put more in service, and that's how that's going to happen.
And how many paramedics are trained?
Do you know the number, Mac?
So currently we have 3 rescues, so 2 personnel per shift. So we're probably about somewhere around 25 to 30 personnel that are trained. We do have other personnel that have the certification, and they're just not on the team just yet. So a total number, I would say somewhere around 65 to 70 people with the certification.
And again, just to answer the question about the medications, these medications on the critical care truck are very potent. They provide great clinical benefit, but they also potentially could have side effects and such like that. So additional training is required to administer these medications, whether it be blood, whether it be paralytics. So unfortunately, right now, you have to be critically care trained to administer them.
And I know it was asked, just to clarify, like if an accident happens, these units don't go automatically. You have to wait and see if somebody's trapped.
Yeah, so if they go automatically in this fire district, their primary response district, they're going to go automatically. But if we have a entrapment on Arlington Expressway and Rescue 19 gets there and says that this is going to be an extended entrapment, then there's a dispatch protocol that will get them dispatched over so they can start administering these drugs or blood products as needed.
Any idea the cost of what you said, what we're doing, how much does something like this cost?
We'll get you a number, exact number.
Thank you all. We're going to